In honor of Mental Health Awareness Month, we're talking about something that affects millions of people every single day, yet so many suffer in silence. Mental health doesn't discriminate. It impacts men, women, parents, students, entrepreneurs, athletes, everybody. And too often, people are told to tough it out instead of being supported, understanding, and given some resources. Today, we're breaking the stigma. We're having honest conversations about anxiety, depression, emotional burnout, therapy, healing, and the importance of protecting your peace. Stay tuned. Let's light it up. Yeah, no filters, no scripts, just the truth. You're now tapped into the fire session, so y'all already know what time it is. Before we get into the fire, you know what I'm saying? Before we jump in that thing, it is hot. You got to do
Yeah,
our check-ins. We got to make sure everybody good before we go on this adventure. So, y'all,
facts.
as y'all can see, we got some special guests with us today. We have Lauren Pierre, we have Angel Adams. They're not new to the show. They're fire
No,
friends, and
no.
they've been here before.
Yeah,
So
yeah.
we got to bring them back in order to talk about these important subjects because we know they know what they're talking about and they professionals.
Facts.
So welcome back, Angel. How are you doing today? Mentally, physically, emotionally, you good?
Yeah, I think I'm good. I'm a little rushed today, but I made it on time. So thank you for checking.
Yeah, yeah,
All right.
yeah,
We'd
yeah. Pleasure to
appreciate you
have you
joining
back.
us.
Hey,
All right, Lauren. How are you on all fronts?
I think she actually gave a good word. I'm also feeling a little rushed today, but the sun was out, and that always helps my mood significantly.
The
So I'm
Okay.
sunlight on the skin helps out. I dig it.
Yeah, we need that vitamin D. We need that vitamin D. And contrary to popular belief, what I'm saying it is good for us to be outside in the sun. A lot of
Facts.
people hide from the sun, and a lot of black folks hide from the sun, but it's good for us to be out in the sun, y'all. So get some of that vitamin D,
Get out there.
those
Get out
sun
there.
rays for sure. All right,
That's
Trish Michelle.
one good reason to put you say you out in the streets. You should be in the streets to get you some sun. That's a fact.
Yeah,
Okay.
you can get some sun in your backyard. You don't gotta be in the streets.
You right. Oh, the streets don't mean you need to be in the streets
Facts,
with sunlight.
facts. All right, Trish Michelle, how art thou?
Oh, I'm good. Rushed per usual. My Tuesdays are busy. I think that's the women. We rush around here. We got a lot going on, you know.
Yeah.
But we made it, and I'm good. It's a good day. It's a beautiful day. It's hot as heck out here in Cali right now, but it's
Good,
fine.
good.
Um, Outside of that, I mean, I'm just making it through the week. I got a lot of off days this week. Tomorrow's my Friday.
Should be looking forward to them
And I don't
joints.
go back till Tuesday. So it's a great weekend.
All right. Well, it's good to hear the ladies are doing well. A little rushed, but they doing well. So Benji
Yeah.
Banks, the man, the brand. How about you, my guy?
Man, I ain't got nothing to complain about, man. You know what I'm saying? I'm at the beach, you know what I'm saying, chilling, at the on the fifth floor, you know what I'm saying? And we're just chilling, you know what I'm saying? Waiting to the show's over so we can hit the streets, you know what I'm saying, and go, see what's out there, you know what I'm saying? Maybe, a little few folks might be tripping, but we're gonna make it all right. We're doing good. No,
Just
nothing to
don't come
trip
this
about.
way. We on fire out in the out
That's
this
why I
way.
left.
Yeah. It's on fire out this way.
That's why I left. It's like, listen,
Now you still nearby very combustible areas. We just gonna pray on it.
I mean, but when the weather ain't acting right out here, you know what I'm saying, baby. Let's just get in the
You know how
car. Let's
Cali
just
do.
go
Let it be
because
windy. If it's too windy for too many days, it's a
oh
fire,
yeah,
a
it's
blaze.
going to blaze. It's going to do its thing. But let's get up by the coast where the water is. If anything happened, we just go
Mm-hmm.
over by the waterway. You know what I'm saying? I'm be like, all right. So yeah, but that's about it, man. Just chilling out. You know what I'm saying? So
All right. Well, yeah, my week has started off good, busy as usual. not rushed, you know what I'm saying? But
Okay.
I can't claim that, but
Excuse us.
it is indeed, yeah, it is indeed busy. But you know what? I'm happy to be here, and I'm happy to be having this type of conversation today because it's definitely needed. A lot of
Facts.
people, you know, if you watch the show, you know, we're big proponents of, you know, saying getting help for mental health. I've had my own issues, and I've had to, you know, be transparent on the show and talk about those things. And I tell you, that stuff is not easy, but I'm glad I had those conversations because when people come up to me in real life and ask me questions about, you know, something they saw on the show, just letting me know that they appreciate me being transparent. You know, it makes me feel good about, you know, what I did and being a you know proponent for it because you can't be out here saying yeah go get help and you don't get the help that you need yourself.
Facts.
So yeah, so I had to face my own advice, you know what I'm saying, take my own advice and you know get some help with some things. But you know, years passed, I'm way better now. So that's why we got to have these type of conversations, and especially we'll get into it too because we had these conversations over the past couple weeks about men. So
Right.
men, we're gonna fuss at you a little bit more tonight because men seem to have a big issue with getting help and feeling comfortable getting help. So we'll talk to the experts about that though. So before we get deep into the conversation, I want to give the ladies an opportunity to tell you a little bit about themselves and let you know they for real. They
Yeah, that's solid.
professionals. You know what I'm saying? They got credentials. So we'll start with Lauren. Lauren, can you please introduce yourself to the audience and let them know a little bit about your background?
Hey y'all, I'm Lauren Pierre. I'm the founder of Free the Mind Therapy, which is a virtual clinical practice that offers individual therapy, trauma-informed group therapy, and I am now offering corporate consultations around anti-burnout in the workplace. So I have been doing this work about 18, 19 years.
Ooh,
One of my specialties and certifications is in trauma, and the other is in substance abuse, but my practice is heavily trauma-based.
for sure, for
Okay.
sure. We
Okay.
dig that. We dig that. They official, y'all. We ain't bringing y'all nothing, you know. We ain't got, you ain't got the lie on wax. You know
This
what I'm
ain't,
saying?
this ain't
You
for
know what I'm
play
saying?
play.
You know what I'm
Oh,
saying?
and let me add, I am a fully licensed professional counselor in the state of Georgia.
Yeah,
There you go.
yeah,
There you go.
Boom.
she ain't Dr. Bryant. She ain't Dr. Bryant.
You
Ooh.
said it. I heard it.
Ooh.
Ooh,
Ooh. Shots fired. Boom, 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 boom.
that was.
She can't even dodge it if she
Ooh,
wanted to.
ooh. That
Oh
woman got a
man.
The
lot of people
school
mad
didn't
at her,
go
but I'm just saying.
disappear over here on her, okay?
Man.
That was a good shot though, Ken. You threw it out there. You know
Nice.
what I'm
Hey,
saying? That's
hey,
good.
it is what it is, you know. Hey. All right. Well, thank you for that, Miss Lauren and Angel Adams. Can you do the same? Introduce
Yeah.
yourself and let the people know who you are and what you got going on.
Yes, absolutely. So, Angel Adams, as you said, and I am a psychiatric mental health nurse practitioner, and I'm licensed in the state of Texas. I have been doing this for 13 years, and my main job is to diagnose and to treat and to prescribe medications for patients with mental health conditions.
Okay.
Yeah.
Yes.
Got your license and all that good stuff. You got your sash and your robe and all that stuff.
I did,
You got
but
your leather.
yeah, you know
Leather.
what I want to say about that though, Lauren. I'm pretty sure you're aware of under Donald Trump, we aren't considered, I guess, professions or something, professionals or whatever. So it just basically means we can't get loan money like we used to because we
Mhm.
aren't a doctor or, a chiropractor, I think. So certain things that they have that
Yeah, I heard about that too.
out of.
Mhm.
Yeah. But it does not discredit us at all as far as
Right.
our schooling and
He
what.
trying to do that to nurses too, if he hadn't already done it.
Mm,
Hmm.
I mean,
yeah.
this administration going to attack anything that they probably don't understand or
Mhm.
intimidated by, you know what I mean? So, but we salute y'all because we know it didn't just start just in an instant. You guys had to take your time, blood, sweat, tears, up all night, whatever, however you want to phrase it. We know it took some time to get there, so that's why we honor the pace and the progress that it took. for you to get there, because we know it's sacrificial. So we appreciate that. So salute to you guys for sure.
Yeah, thank you so much.
All right. So let's start here. Angel, what inspired you to even want to get into this field of mental health?
Yeah, well, when I went to nursing school, I did not think I was going to end up in this field. That's the crazy thing. I thought I was going to be in the ER. And so when I was going to school, I remember taking the psych class and I said to myself, I'm not going to be doing psych. So lo and behold, the first job I got was psych. I was scratching. I was like, I need a job. So I'm going to
Right.
take whatever field I could get, and so it started there. And I was working with the elderly. They were in a daycare, like daytime daycare. And it was just very interesting to me. And I just kind of fell in love with it. Then I went to a psych hospital, and then I decided to further my education to become a nurse practitioner and still specialize in psych. So that's how I fell into it. And I've been here ever since.
I like that. I
Wow,
like that.
interesting,
Yeah.
interesting. We've heard that from quite a few of our guests that they started out aiming for one direction and
Mhm.
ended up, the field that they're currently in. And I want to believe, you're where God wanted you to be.
Yeah,
Right.
You know what I'm
Right.
saying? Like,
absolutely believe
that's what I've just found out in my adulthood, throughout my adulthood, is sometimes we want things and God says, haha, I got something else
Yeah.
for you.
He gotta put you where you're supposed to be.
That's a
Yeah.
fact.
Yeah.
That's a fact.
Uh-huh.
Facts. All right,
Mhm.
Lauren.
I'm pretty typical in terms of I knew in high school what I wanted to do, but it just came to me in terms of just talking to people. So I always felt like I really liked talking to people. I really liked supporting high school dramatics and melodramas that were going on in people's lives.
Right.
So by the time it was time for me to go to school, I went with the intention and I fully registered as a psych major pre-med, because at the time, my only understanding of offering therapy was as a psychiatrist. That was my only understanding. So you had to be pre-med because a psychiatrist is a medical doctor. I learned in my first semester that math and science is not my spiritual gift.
She's like,
The school intervened real quick and they were like, look, sis, this ain't for you. So
Right.
you can either make some changes to your major or you can leave. Those were my only two options. I had to go on.
Wow. Wow.
But it was a godsend because it was because
Yeah.
of that I learned what my other options were for providing mental health care. And that's when I learned about what a professional counselor is. And in other states, it could be the initials would be mental health counselor. In some states, it's community counselor. But essentially, I wanted to do the practical, experiential work of in-person therapy. I didn't want to prescribe medicine. So I wasn't even doing what I wanted to do anyway when I was pre-med. So thankfully, because of that shift, I learned what it was I really wanted to do. And that better helped me choose the most appropriate graduate program as well. So I was able to position myself in a program that was specifically about providing the applied work of therapy in session. And that's how I got here.
I like that. I like that.
Okay.
When you guys when you're making those decisions, do they have to be quick? Like, do you have to rush into this because you're already in school, you're already enrolled? How long does that process usually take for you to make that decision and then decide this is what I want to do?
Or do you mean like as far as when I first started or when I
Yeah.
decided to further my education?
When you first started, because you found out you wanted to do something else, and then there's a
Yeah,
transition.
right.
How long does that usually take, and how does that usually go?
I would say it was a journey for me because I started off in journalism because I have a degree there. So I was doing some work out here, not making no money. You hear me?
Right.
No money. And nursing was already on my mind. And I was like, I got to get back in school. And so it was really like, do it,
Right.
apply, get in, get it done. And even with me going on to graduate school, I had just had my second child. She wasn't even one. I said, I gotta do it. I want to
Right.
further, I want to advance myself. So yeah, it was pretty quick decisions for me, but it
Right.
was part of my journey. Yeah.
Yeah, get them super dope stories, because as entrepreneurs and people pursuing, sometimes those little pieces, those little nuggets don't get pushed out there as much. People think you just jumped in it and then just instantly start going to school and it all worked out. And then you come to find out, no, you had to make some adjustments along the way. So those are always important, especially with school and entrepreneurs and people pursuing professions.
So Lauren?
Was it quick? I don't. It was quick in terms of, like I said, the school gave me two options: either you leave or you make school.
You had to quickly make a decision.
Yeah.
You had to make the decision quick, right?
The end of first semester of my freshman year, as far as my parents were concerned, I only had one option, which is to make the adjustments, go on academic probation, and just drop the pre-med part. So that was a easy decision because I felt like that was my only option. Just drop the pre-med, get on academic probation, focus on the psychology, get your grades back up. So I went to summer school, two out of the 4 years I was in school, to correct what I had done the first semester when I was pre-med.
Right.
So that's an extra effort that I had to make. That's extra money that I
Yeah.
had to go into that in order to make up for the time that had been lost in the wrong direction. When it came to graduate school, I actually did not apply to graduate school before I finished undergrad. I finished undergrad and I took some time to kind of research some schools and decide what type of graduate degree I wanted, because everybody was getting PhDs, but I knew I didn't want a PhD. So I was just like, okay, if I get a master's, how is the master's going to be beneficial? Am I still going to be able to do what I want to do? So I actually, the year that I graduated from undergrad, I actually just worked and did psych research at Georgia State as I kind of decided what I wanted to do. And then I applied to graduate school and I started graduate school the following year. And then I finished that. And yes, like so many therapists, I did consider getting my doctorate, but my master's degree was out of my pocket. Like once it's your own money, you have a very
It's a different story. Yeah.
So like master's was my pocket and loans. So I couldn't get in more debt with my doctorate. Today, if I was to get free money, if somebody was to sponsor me, I would absolutely go back and get my PsyD. But right now, I'm just going to continue to change lives with this master's and this license.
Hey, make it work. Got to work it, right? Once you get it, you got to work it because now you're in it, right? And the loans kind of do dictate, make something happen. So I totally understand that part.
Yeah, the loans is definitely motivation.
It's that out of pocket when it switch over.
Well, the money you're paying is definitely the motivating factor. Like you paid for it, so yeah. Yeah, but I like this part of the conversation, and we're going to shift a little bit and get into more of the mental health questions. But I like to ask these questions so give people an idea, because there are people out there who are interested in joining the mental health field in different capacities, and I like the fact that you all kind of have two different areas in which you're in, and people can see that they just don't have to be in one area, or there's many ways that they could, go about this journey. So I myself have even thought about it as well. So just learning and hearing these conversations is inspiring, and hopefully somebody else hears it and it inspires them to want to help out as well, because I'm pretty sure that the field has people in it, but I think everybody has a purpose, and somebody out there, this is their purpose. So you know what I'm saying? We appreciate you all letting them know about your background and how you got here. So while we're transitioning here, I want to go Lauren first and ask her this question. We're going to start very basic. What's the most common mental health conditions that people are struggling with that you see today?
So you have to keep in mind who my target client is for my practice. So I see primarily untreated trauma. Sometimes it's PTSD, sometimes it's not PTSD, but it's untreated trauma, anxiety, and depression. Those are the things I see consistently.
Okay. That's interesting. Yeah.
Yeah, I mean that before you even said that, those are the ones that came to my mind, when I first read this question, because from the conversations I have, that's what a lot of people are dealing with, anxiety and depression. So Angel, from your perspective, could you provide the information for that same question?
For me, I'm going to say the most common, it runs a tight race with depression, but generalized anxiety disorder is going to be the most common. So generalized is kind of like a worry wart. You worrying about everything. Is my kid going to make it to school safe? Am I going to get fired? Just like everything you're worrying about. Politics has, I have so many patients coming in concerned about the state of the world. Just, am I going to be able to eat? You know what I'm saying? Can I pay my house note? Things like that. So I'm definitely going to say generalized anxiety, and then follow behind that depression, and probably after that ADHD. And some people don't even think that's real.
Yeah.
Right,
Yeah.
right.
That's funny that's your guys' answers, because I mean, I deal with getting them scheduled with the therapy. So the whole questionnaire, figuring out, deciding on crisis and the OD therapist and all this other stuff. So the main stuff all day, every day,
Mhm.
ADHD for sure. They
Yeah.
they self-diagnosing sometimes too with that. But
Okay.
the two top is that anxiety and
Mhm.
depression. Mhm.
So, Lauren, when you're actually when you're in your space and you're in there, what is the first thing you would do or say or try to help a person that is having anxiety in this space? You're counseling them. What is one of the first things you would try to speak to them to kind of get them out of that space?
It depends on the origin of their anxiety and what's associated with it. Because if his anxiety is a result of unresolved trauma, there's a whole
Mhm.
particular technique and intervention that I go through where the anxiety gets addressed in the work of the trauma. But if they're coming to me just with anxiety, that's actually rare. More times than not, I'm getting people who have anxiety symptoms that are co-occurring with some other diagnosis. But if they're just coming from anxiety, then the first thing we're going to go through is just some anxiety management techniques, just some things they can take away either from the first session or the second session and start practicing to specifically manage the symptoms that are showing up somatically. So if your anxiety is showing up as increased heart rates, pressured breathing, your temperature is going up, let me give you a couple tools you can practice when you leave me so you can at least start regulating your body. And then in the continued work, we continue to practice that. And then we start working on the anxiety that's up here.
Okay.
First, I'm going to help you just manage your body so that you can think clear enough to even do the head work.
Right.
Yeah.
Mm.
Got to do that head work. That is a fact for sure.
Okay. Did you have another question for Angel?
Well, I was going to say the same question because hers is in a different space. But what is the
More
first thing that you
generalized.
would do? What was the first thing, the information you would try to give to your specific client in that space that you're operating in?
So I need to figure out first, when they're coming to me, where is the anxiety coming from? I need to find a source, or how long has it been going on? Um, is it only happening in certain situations? Or some people just say, I don't know. I can't
Hmm.
figure it out. Well, is it a gut issue? The gut and the brain, they're communicating all day.
Communicating together, right?
Mhm.
Are you eating right? Like, so I have to figure that out first, and then I can tailor my treatment plan more better if we're going to get on medications, if they're even open, or, am I just going to refer them to a therapist for the time, or, is it severe enough for me to do? I refer them to IOP, which is an intensive outpatient program where it's a step up for me because I'm outpatient. So they would really hone in on what's going on. So that's how I have to figure out my patients and what I'm going to provide for them.
So they can't be eating hog maws every day, huh? They can't be eating fat back and pig feet
Well,
every day,
I don't know.
Eating that every day is crazy.
I get down sometimes.
huh?
When I
Most
go,
women do. Most women do.
so I'm not going to hate
Listen,
on all that.
she's like, wait a minute, leave my pig feet alone.
She
Listen,
said,
some
focus
people,
on your own gut."
Exactly.
listen, some of these grandmamas will fight you if you don't give them their pig feet. Do you hear me?
Right.
They be ready to go to blows. Don't you mess with that. You know what I'm saying?
Yeah.
All
Mhm.
right. So with us having this discussion about the people and the first steps, I want to ask you, why do you think so many people like avoid getting help from the beginning?
Well, for one, I think it's just another task. As an adult, we have a lot of things to do and take care of. So it's just another task, and it takes work. Once you go into therapy, or once you come to somebody like me, it's going to take time and work to figure out what's going on with you. And if you're comfortable in your mess, it's not really an incentive to really fix it. You might want to, but you know, you might need a push from someone, or just the timing. The timing has to be right. So I think that's it. And then of course there's the stereotypes of certain groups that's common, that could really delay getting care and mental
Stuck,
health.
stuck in your mess. Gosh, man, that'll preach over the pulpit right there. Because a
Mhm.
lot of people are comfortable with how they are. They don't
Mhm.
want to change. So
Mhm.
I know that could be challenging. So do people actually walk in, need therapy? You're recommending it, and then they don't want it. It was like a one-time thing. That's it. I
Mhm.
ain't ever coming back here. Do people ever do that? Does that ever happen, Angel?
Yeah, that's definitely happened to me. Or my spouse said, I need to come up here. I
Mhm.
don't think nothing wrong with me. I'll just use you as needed. If I didn't, so yeah, I've definitely experienced that.
Mhm.
Right.
Yeah.
Angel
Right.
say, Lauren, the same thing. Do people just, hey, I'm just going to hear appease you for this one session, and then I ain't ever coming back? I know they're probably not as blunt as that, but I'm sure you experienced that too as well. Can you elaborate on that for us?
No, I have two coming to mind right now over the course of my career, and they weren't even in the same year. They weren't even years close to each other.
Uh,
But to the conversation we're gonna have later, they were both men and both came
okay.
in because a spouse or partner
Mhm.
essentially told them you need to go to therapy or like something is going to happen. And
Oh,
they were both very frank. They weren't disrespectful at all, but they were very frank in saying that I'm only here because my girlfriend told me I need to come to therapy. And the other gentleman said I'm only here because my wife said I need to come to therapy. But neither one of them felt like they needed it. Neither one of them saw any issue with themselves. And therefore, when you ask about what's bringing you into therapy, they're not going to say what the partner wants them to say because they
Yeah.
don't see that as a problem. They're just going to
Mhm.
say that my girlfriend feels like I need to go and my spouse feels like I need to go. And then I'm pulling teeth the whole intake to try to
Yeah.
figure out
wow. Right. Right.
Right. They
why
right
you
there. Like,
He
Spent
just
the
there
first
so he don't
30
get
minutes.
fined.
Yes, spent
yeah.
the first 30 minutes just trying to get through the intake, and you can't really get through the. I could definitely see that. That's like denial, though, right? Like it's somebody's recommending you to go somewhere, especially someone you would think that cares for you. But I can understand men. We don't like to feel that vulnerable. It's like, yeah,
mhm.
man, I ain't feeling this. So,
Mhm.
yeah, I
I
don't feel
mean,
like doing this. So,
mentioning therapy could bring up a defense. So,
very
I
true.
mean, how would one go about navigating telling someone that, or suggesting to that person that therapy may be the route to go for whatever it is that they may notice or not notice that they need help with? How would you guys suggest that? Whichever to want to answer first.
Well, first of all, I agreed with Angel fully when she was describing people wanting to be in their mess or not thinking anything is wrong.
Yeah.
So when someone is suggesting this option of getting some support, getting some emotional support, and I don't think anything is wrong with me, I'm not going to probably listen to that until doing what I'm doing no longer works for me.
Mm.
Mm,
So I have to get sick and tired of being sick and tired with myself.
Mhm.
mm.
I have to get uncomfortable enough that I feel like it's my choice and my decision and my idea
Yeah.
to come to therapy. Because if I'm fine, if I feel like I still get what I want and I have what I have and I don't have to change, there's very little, if anything, that's going to convince me to go to therapy until I'm sick and tired.
Yeah.
Yeah, I can definitely see that, especially for men, because we could be stonewall. But I like what Patricia said. Like that could bring up a wall. Like, oh, you think I'm crazy? Because that's when we
Mhm.
think therapy, when we think psych, when we think that's the first thing people think is you're crazy.
Yeah, that's the
Yeah,
biggest
No,
misconception
yeah,
right
there's this
there.
for
misconception. Yeah,
sure.
like you're crazy, but no, I don't think that we gotta. I don't know how we get out of that space, but sometimes you just need to help somebody help you manage your life. Some
Mhm.
people
Yeah.
just don't manage life well. They don't manage things well. Time
There's a lot to
management.
manage in life.
Yeah.
So,
So I think that's a tough space to be in, but to be able to sit down and talk to somebody who can give you a great assessments on how you can do a thing better. I mean, to me, that sounds like a win, but I know everybody doesn't view it that way.
Yeah.
I think one of the biggest things is you were saying, how can we improve it is just by education.
Right.
Education, educating people, doing what we're doing right now. What I'm saying,
Facts.
giving them information, allowing them an opportunity. Like people, you're out there in the audience, and if you're watching live, you can type something in the comments. If you got questions, we can ask questions. We can have those conversations because that's why we do this. We want people to have the opportunity to ask questions because sometimes you don't want to go to these professionals in their environment because you feel intimidated. Well, you can ask here and you don't even have to show your pretty face. You can ask and we can ask for you. We can get the information for you, but we want to make sure that people have an avenue to get the help. That's the most important things. And this is what these ladies do. These ladies
Facts.
offer help of many different varieties, but because the beautiful thing about mental health is it's not one size fit all,
Right.
right?
Mhm.
Everybody has their own journey that they have to go through, and some people's is a little bit more arduous than others, right? Some people have a little bit more to unpack, and but they're professionals, they can handle that. So one question I had too while we're talking about this part of it is, what does healthy emotional processing kind of look like, right? When you are talking to somebody who's coming to you, Lauren, and you see the light bulb go off, you see that it's starting to work, you see that they're having a healthy emotional processing. What does that look like in your eyes?
I love this question because it speaks indirectly to how we treat trauma without even realizing that's what you were doing. Because the techniques that I've been trained in to treat trauma, they require that you work on the body as well as the mind. So we talk about processing unprocessed information in the body and the mind. So for me, processing emotion typically includes three things. First, having the language to actually describe what you're experiencing and having the words for it. You would be surprised how many people do not have an emotional vocabulary. They
Wow.
know happy, sad, mad, and then there's some variation of happy, sad, mad. But they don't know the other like plethora of emotional experiences that we have as humans. So giving clients language to now better communicate with me what they're feeling is a huge part of processing emotion. Then we got to process it through the body. So you'll hear a lot of therapists who do somatic work. I've done somatic training. I'm not certified in somatics, but I offer somatics in my work because part of processing emotion is being able to identify how your body is responding to it. So that's really easy when we talk about anxiety. Most people living with anxiety, they can feel it. They know it in their body.
Right.
But
Right.
people who have been holding trauma for a long time, they might not always recognize it in their body as quickly as they could. So we give it language, then we work on identifying it in the body. We learn how to digest it in the body, and then we move up to the head and we work on how it has distorted our thinking and how it shows up and how we interact with the world and with other people.
Mm.
So those three areas kind of like move in a circle when you're doing trauma work. You're kind of constantly moving in and out of those three things for processing emotions.
Ooh, that was good.
I hope that makes sense because I feel like I went on a tangent at some point.
No,
No, you,
it's
No,
you
good.
for sure.
the first thought that came to my mind was your body keeps the score. Like it's telling you these little things, and you got to be able to emotionally process it and be real with yourself. You got to be authentic with yourself because I'm gonna get the language, I'm gonna get the information from my therapist, I'm gonna get that. But then now I'm with Angel, and I might need some meds, and that might be that might be a little bit more challenging because the person is already feeling, why am I here? Why this? Why that? And Angel, do you get any pushback in that when you're giving assessments, and then now we've come to the place where I think you might need this? How does that go? How does that work? Because I know, people might feel some type of way, especially if it's men. I know you can smile at them and they might do whatever, but you know what I'm saying? How
Right.
does that work? How does that work?
Well, most of the times when they come to me, by that time they know, like, okay,
Okay.
this is what she does. But I do have that pushback. I do experience that. Like, okay, well, maybe if I come back next month, let me think about it. Let me, research a little bit more, and I'll send them information as well on medications that I'm thinking about could work for them. So it's definitely there where it's just like, hold on, this ain't what I came for. Or can you think of some supplements that could help me? Some
Right.
ashwagandha, this, that. And so, yeah, so I do go through that with patients, and it's okay. I'm willing to go as long as, they feel comfortable and they feel it's time, but I'm still going to give them my professional take on what I think is best.
Right.
Right. Well, I want to ask too, when it comes to, especially with the medication piece of it, I know that's like one of the biggest taboo, conversations when it comes to mental health is, you put me on the meds. Oh, that boy on that meds, or she
Yeah,
on the
crazy,
meds,
huh?
But how can family support people dealing with, anxiety, depression, and having to be on these meds? Because it's important for the supporting unit to understand that this
Mhm.
person is on medication and they may have mood swings and so on and so forth, especially when they first start. So, can you talk to us a little bit about that?
Yes, that is definitely important because I've had situations where my patients will come in and say, so and so say I don't even need this. Like, why am I taking this? Why can't I just act right? Why can't I just go outside and not be anxious? I should be able to do that. So when they don't have that support, it makes it so much more difficult. So having family members come into my sessions sometimes when I'm with my patients helps a lot, so I can educate them as well and say, hey, this is a chemical imbalance. Something is
Mhm.
going on. Like something caused it, maybe genetically, environment. I can't really tell you exactly because it's very, very complex, but there's definitely a chemical imbalance going on.
Mhm.
So you need to understand it. It ain't no just I can fix it just by thinking it away or wishing it away. Praying is great, but we all know, I mean, God can give us stuff overnight, but He usually
Right,
makes
right.
us for it. So
Yeah.
I'm not going to tell you not to pray about it, but it's just, it was given to us for a reason. There are smart people out there that able to make medication and make it work. So just the education is it's very, very important for the families.
So I can imagine on the flip side of that, that there are family members that are kind of detrimental to someone's progress because
Mhm.
I mean you don't need that. I can imagine hearing that. You know
Yeah.
what I'm saying? And everybody know Uncle Willie. Yeah, no, Uncle Willie a little special. You
Yeah.
know what I'm saying?
Yeah.
So like how does that communication go with the family because they have to have that information? How does that go? Because I know some like again, we're dealing with people who are on the defense most of the time.
Yeah. Well, oddly enough, in session it don't be the pushback with the family. It's just what the patient is telling me when they're alone.
Mm.
It's like the family member comes and they'll listen. It's almost like being on their best behavior,
Uh,
type thing, to where I don't know, maybe they don't want to offend me by what I'm saying or whatnot. But I mean, at least they do listen. They take the time to get there, and it's just a process. It's just a continuance of working on it, working with them. And
mm.
they may not be a full believer, but when they see them not acting crazy,
Spazzing out. Yeah, that's what
then
seeing is believing, right? Right.
you're like, okay, maybe this is working. Bob didn't just throw his fork at me, because I didn't give him the right type of food.
Right.
So, yeah, yeah.
I
So,
can imagine that too, because I know just being around, kind of watching shows and being around people and stuff like that, you can see the difference in them when they're actually on their meds, and
yes.
that could be a tough conversation to have. Like,
Mhm.
bro, are you off your meds today?
Yes,
Yeah. Well,
yes.
that's serious too. You could support in making sure that did you get your refill put in?
Yeah,
Right, right,
exactly.
Because that in between
Yeah.
time where they need that authorization or that follow-up appointment and they don't stick to those, and then
Mhm.
they get very mad when they don't have their refills, and then I know you guys, but where you definitely deal with them angry and upset requesting
Yes,
that refill right now.
they want them refills then. If it's 12 a.m., I want my refill and I want it now. I don't care that you sleep.
Mhm.
Oh Lord.
Yeah, you got to come to this appointment.
And now when it comes to that too with psychiatry, I think there's also some people don't, and maybe you guys can help explain it to them, understand the importance of both a therapist and a psychiatrist working together, the need for both and the difference between the two and how they work hand in hand. So maybe you guys could help just make sure, because there's a lot of people that get the therapist, do the intake, get to psychiatry, drop the therapist, you know.
Yeah, and then try to use me for therapy. I'm like, I didn't learn all those modalities. You need to
Exactly.
go
And so and maybe you
over
guys
there,
can explain
honey.
that to
Mine
them.
is more cut and dry. No, I'll
Right.
try if that's what you want, but I'm just gonna talk to you just like this.
Right.
I'm gonna use that little vocabulary Lauren said: happy, sad, mad.
And that's it.
And that's the importance of Lauren, right? Lauren, that's where
Exactly.
you, like she was saying,
Exactly.
the behaviors and those type of things. That's where something that you're gonna teach them on how they feel and what they need to do. And then you're over here medication and chemical imbalance and figuring that part out. But hand in hand, they people will drop one and the other, and you guys gotta have both you guys work together. You guys are like a little happy marriage with the individual.
And
Yeah.
some
Yeah, I know.
people don't always realize how much we're advocating for both sides. Like I
Mhm.
haven't I have a list. I had to create a list with the help of colleagues in my consultation groups. I have a list specifically of psychiatric nurse practitioners and psychiatrists licensed in Georgia so that I can refer my clients accordingly. Because
Right.
when I can see the symptoms and I get the history, and in my intake, I could tell you've been suffering with these symptoms for a significant period of time and you have not been willing to get medicated, then I do have to get into the education with you. I do have to explain to you how medication could help you manage your life better. And something I often tell those clients, the clients that would benefit from medication, that you have no reason to continue suffering when there is a resolution. Like there's a
Right.
solution to
Right.
your suffering and you are resisting that out of stigma. So I will spend significant time talking to my clients and destigmatizing medication use. I will compare it oftentimes to medical issues to help normalize it, reminding especially our community. Everybody knows somebody with diabetes. So somebody
Yeah.
with diabetes is managing that on a daily basis. They're
Right.
either managing their insulin, taking their blood, or taking some kind of medication for the rest of their life. And you don't
Right.
have any stigma with that. Or I'll use other medical related comparisons and say, this would feel less stigmatizing. You need something for your mental health too. And one thing I will say, I love me a good psychiatric nurse practitioner because my clients don't feel as stigmatized by if they had to go to a psychiatrist, because it's so funny how our culture thinks, right?
Mm.
They think psychiatrist and they see white man in their mind. They see
Yeah.
white man trying to
Yeah.
give me drugs and make me numb. When you explain to them what a nurse practitioner is, because they didn't even know that was an option, so that's a part of the education as well. When you explain to them what a psychiatric nurse practitioner is, there's something that feels more, I want to say nurturing, but that's such a cliche word. It feels less formal. It feels less cold because I think the connotation with nursing in general is a better bedside manner.
Mm.
So usually my clients will be more willing to see a psych NP first and get therapeutic levels of medication, because for them it's like, okay, I'm gonna try it. I'm gonna just try it, but I don't want to try it with him first. I'm gonna
Mm.
try it over here first.
Yeah.
And it's like that's their step in. That's their putting their toe into the waters. I'm gonna try it right here. And I have so many clients who that's the only way I've been able to convince them is to say, okay, look, let's try a psych NP first. And it's so funny. The ones I have on my list are all women of color. So that
Mhm.
also makes my clients feel a little more comfortable. And I say, look, work with this psych NP, let them measure your levels, do your med assessments, constantly tell them what your symptoms are, and
Right.
let them tell you if you need to go up on a dose, if you need to change a brand. And, you know, I'll check in with you too, because I'm looking at you in your face for an hour every week. So I
Right. Right. Right.
it's not going away. And
Yeah.
I oftentimes have to tell my clients what they need to tell their NP because they're skipping information. I'm
Mhm.
like, no, write this down.
Why do you think they're scared and they're skipping that information? Are they scared of the process, or what would you say in that space? They're scared of that. Like, what's going on there?
No, they really don't know how to do this. They don't know
Okay.
how to have these medical conversations about mental health. You have to keep in mind a lot of people in our community don't know how to go to the doctor. I know that sounds really weird, But a lot of our people have never scheduled their own doctor's appointment. They don't know how to check their My Chart. They don't know what a doctor's going to ask. You know, they don't understand things like copay and deductibles. A lot of people in our community just don't know how to do that. So if I don't know what I need to tell the doctor to get the best help, I definitely don't know what to tell a prescribing professional
Right.
to help me with my mental health. So like I'll have clients that are telling me things and I'm just like, okay, but did you tell the prescribing physician that? And they're like, no, should I? Yes. If you started having these extremely vivid night terrors and you've never had night terrors before, please tell her.
Right.
That could be a side effect from your meds.
Yeah.
If you just realized today that you have not eaten in 2 days, please go tell your prescribing physician.
You mean you didn't have pig feet for 2 days?
And see, sometimes they don't recognize the correlation between symptoms and mental health because they don't seem related to them.
Yeah.
But Angel and I do this work, so we can hear it and we know, okay, this could be something with your meds.
Right.
It can cause you to lose your appetite. I've had a lot of clients on psychotropic medication that activates their dreaming, and they have no idea that that's their psych meds doing that.
Yeah.
So there's a lot of education we're constantly doing, and we are constantly crossing over referrals and trying to get people to get the whole picture of their health and wellness.
Okay. So see, and that's the importance of what we're doing here tonight. And then I really appreciate you all explaining your role in the process and how you work together so people can understand, you know, how it looks, the whole picture and bits and pieces so they understand. And what I was also going to talk about, and it's funny that we're here at this point, is you talked about people not knowing how to deal with, you know, medication, not knowing how to go to the doctor. And that's learned, right? That's something that we learned growing up. That's something that we, you know, our parents taught us, or that we learned as adults, you know, just growing up. But the question I had is, growing up, was mental health talked about in your households? Because I think now with these kids growing up, like there's more conversation about it. Whereas when we were growing up, nobody was talking about it. Like it wasn't even a conversation. And if you did, my parents were kind of like, yeah, you might need to talk to the counselor at school about that. Your parents gave you a referral to somebody else because they didn't know as much about it. So now with, you know, the kids, you know, actually having access to, you know, these conversations and this information, are you all seeing more kids and, you know, people at a younger age coming in with more needing more mental health you know, help?
Angel, that's not my ministry, so I'm going to let you. I don't work with young people.
Yes, definitely. Well, the first part of what you said, no, definitely mental health was not talked about in my house, not in my friend's house. And if something was off, all they'd be like, that mind crazy. Like, all those would be said, you know, like that mind, right? So, but not thinking like it's mental health, really, like, you know what I'm saying? That the connection wasn't there at all. Yeah. But you know, now as an adult and living in a world where it's talked about more and it's a thing and it's out there, yes. It's the kids, they're tearing it up. I need a mental health day. My kids say that.
Right.
No, you're abusing it. You need to go to school. You know? But for those that really need it, that it's there. And there's so many different resources out there now that are just provided for these kids and for adults and for the elderly, everybody. Yeah. So,
and that's dope too, because I know a lot of the kids are experiencing stuff that we didn't per se talk about growing up, but now these kids are a little bit more social. Not all of them, they're a little bit more social now, and so they're kind of talking about some of the things that they're experiencing, whether they put it on Snapchat or Facebook and or whatever. They're a little bit more social. But they do need the services. They do need that, because we're seeing an increased intake of kids actually having mental health issues. So I know that's a good space for them to come to, but we got to push that for them for sure.
I think they're more social, but only because they don't have to talk face to face.
Yeah,
It's
I agree.
easier to say something when you can send a text or when
Yeah.
you can just put it on Snapchat, you know what I'm
Right.
saying? Or when you can send it to somebody's inbox and you don't have to look at them eye to eye and say it.
Right.
So I mean, in that aspect, yeah, they're probably a little bit more open to talk about things like that. But I mean, for us, like, yeah, there's
Yeah,
no
nah,
way. There's no way I'm telling my partners, man, I'm feeling depressed today.
no way.
They be like, boy,
No way.
boy, if
I
you don't
don't
get up.
even, but we didn't even know how to talk like that back then.
That's a
Well,
fact.
I'm
I was
telling you,
depressed,
I'm
like,
telling you, in my household, shout out to my mom, love you, mom. If I said, Mom, I'm depressed, she would have said, we're going to
Depressed them
press them
dishes.
dishes.
Depressed them dishes.
You know what I'm saying?
Yeah.
Like that's the
Depressed
response
that
we
y'all.
got. That's the response we got. But you know, I'm
Press that
thankful.
laundry.
Yeah, I'm thankful that we've come along and we understand the you know the need to actually have these real conversations with our kids and allow them the space to to tell us things and be more transparent, but not abuse it with the mental health days.
yeah.
So but we talk about the kids, but we have to talk about the men for a minute, right?
Yeah.
Mhm.
We have these conversations a lot, and a couple of groups that I'm a part of locally, we've kind of spearheaded and we've gotten groups of guys together to talk about guy stuff, right?
Right.
Because all too often we get together and we have a place called the barbershop,
Mhm.
right? That we go and we talk about sports, we talk about women, we talk about everything under the sun, not our mental health and not the things that we're dealing with that, you know what I'm saying, could make us better men on that aspect. So what we do is we have those conversations, and it's been life changing for
Right.
a lot of us in those groups and have those conversations. So I want to ask you all first, why do you think that men avoid seeking help? Is it a bravado thing? Is it an education thing? Lauren.
There's still a lot of stigma in our community in general about mental health, which I'm surprised about. Like every year that goes by, I'm like, why is this still stigmatized? I see more of us, and I'm starting to see more men. But I think for men, there is something tied to this is just my observation. I have not done the total research on this, okay?
Right.
But
Right.
in my observation, there is something tied to masculinity and manhood that is
Yeah.
not emotive. So when it requires there be a deeper emotional work or a deeper emotional intimacy, there's an internal conflict around that. And you can only go so long with those kind of defenses up before they don't work anymore.
Right.
So
Right.
typically what comes to me in the few times I get male clients, because it doesn't happen that often. And when I see them, I'm like excited, like, ooh. But they are typically coming because something has fractured in their interpersonal relationships, and they are no longer able to avoid some of the emotional things they've been avoiding. And they want to now do the work to figure out how to fix this because there's too much on the line. So they start to realize what they could lose if I
Yeah.
don't figure out how to work through this.
Yeah.
And then they oftentimes feel more comfortable doing that with a woman, doing that with a therapist that has more of a feminine energy because that feels safer
Right.
than working with a man. Now, is that the case for all men? No. Because I want to plug an organization in Georgia that I think I mentioned before. It's called Counseling Brothers of Atlanta.
Yeah.
And it's an organization of male Black therapists who make themselves available and present and promote the emotional and mental well-being of Black men and boys. So it's
That's
there,
dope.
but I really think that has been a hurdle for men for a long time, is that tie to masculinity and manhood somehow being anti-emotional, and something about emotionality having a feminine connotation. And we have to change that. Like that's been strangling us. That's had a chokehold on Black men, and it's not yet released.
And I agree, because but the part that you said also, I think that's really dope, is sometimes, drastic measures, kind of need to be taken for me when they feel like I'm about to lose, maybe my woman, maybe my job, maybe my this, or whatever it is that is valuable to them. They kind of put a little bit more pressure on kind of getting the help. So sometimes the drastic measures, because men, we just, we weren't taught that. I
Mhm.
mean, I think more of our therapy was going outside and playing as kids, but that was it. And but overall, it's just weird because that emotional defense does get up, and until we have somebody mention it to us that we actually trust, that's when we kind of really step into that space. So I would definitely agree with that part. That sometimes it's just drastic. You got to
Mhm.
go get something done, like bruh, like you really struggling. Go see some help. Go get some help.
Yeah,
And
and it's
I
so
love that.
it's perpetuated because if you think about the language, like men will refer to each other as weak or a
Right.
simp, or
Right.
like even call each other the B word if they feel like you acting too emotional about something. It always gets dismissed and
Right.
and demeaned as being something that's less than manly. And
Right.
men do it to each other. They do it to each other.
That's
So
a
when
fact.
it's reinforced like that, that's even more reason for me not to let this out, not to talk about it. I don't have a
Yeah.
safe place to put it. And
Mhm.
unfortunately, I think this came up in a conversation with a colleague recently. Unfortunately, sometimes women perpetuate that on men too.
Oh, very
Mhm.
true. Very
Yes.
true.
And
Very true.
sometimes it's all over social media.
Oh
Yeah,
yeah.
women will contribute to that trope around someone being too soft or
Mhm.
someone man being a simp or you have to be man enough to be my man. So much of the jargon and the colloquialisms perpetuate that idea that emotionality is not manly and being hurt is somehow weak. So we have contributed to that a lot, and we have to work on changing that trope and that narrative.
Yeah.
Y-
Absolutely.
Yeah, that's important. And, what we're talking about now is, bringing me up to another question I had about the dangers of emotional suppression. Because with guys, that's what we do, right?
Yeah.
We're taught just, what I'm saying, just deal with it. You'll get over it. What I'm saying? We just
Mhm.
keep
Keep
packing it away
pushing.
in our backpack, and eventually that backpack gets very heavy, and we
Right.
can't we and we need some help unpacking it. And that's what a lot of guys don't understand. And that's why I try to use that analogy to explain to a lot of people it's easier for somebody else to reach in that bag on your back to help you unpack it than you trying to reach in there yourself and unpack it. So
Mhm.
Right.
we need help. I'm not telling you you got to go and you got to see a therapist or a psychiatrist for 6 months, 10 months, 12 months. I don't know. But what I'm saying is go for
Yeah.
at
Go
least the
see
first
somebody.
time.
Yeah.
Yeah, for at least the first time to allow somebody the opportunity to at least explain it to you, to
Mhm.
at least know that you made some steps yourself to get
Mhm.
to get it done, and you didn't have to wait until somebody else told you or until you harmed somebody to
Mm,
an extent to where now you can't undo it, right?
You
right.
Because that's what
lose.
we're experiencing too. Because
Mhm.
there's so many stories, and it's crazy the stories we hear about these murder suicides, and
Yeah.
Yeah.
it's guys doing this,
Mhm.
and it's like they're just overwhelmed. So,
Black
um,
men. It's
Yeah.
yes, yes.
Which is very which
yeah.
is
Go ahead, Angel.
very interesting because there was a time when you didn't see these high rising numbers of black men committing suicide. It
Mhm.
just wasn't there. Like it was statistically, it wasn't even there. And now we're seeing that rise, that
Yeah.
intake. Angel, what do you say is the contributing factor to that space for a men kind of just kind of giving up on life or whatever it may be?
Well, I think that men have been taught to provide, protect, and perform over and over again.
Right.
There is no space for emotions. And, men have not been giving the tools, the language, the safety to be able to process their emotions effectively.
Right.
And, we're in this crash out culture too, with more so
Mm,
the younger black men that's doing the murder suicides or just suicides, to where it's kind of a trend. You have that going on, but it's just what men have been fed over and over again. And again, that's why it is very important for people like Lauren and I and Shell to really just push, like, it's okay. It is okay to feel your emotions, to
hmm
reach out for help, to just get the help that you need. It is very, very important because we're really in dire times right
Yeah,
now as it concerns mental health and our Black men. We
I
really are.
agree. I agree.
Yep.
Yeah, for sure.
And I want to add something that too. I think there has been over the years some either direct or indirect messaging around there being more honor in death than there is in vulnerability. And how men are more willing to put their lives at risk for something than have to be transparent or exposed or vulnerable
Mhm.
at all. And sometimes it is easier to just say, I would rather not be here anymore than to have to keep
Yeah,
Yeah.
yeah. That
That's tough.
definitely, I can 100% agree with that because again, being in the space, I've been there before too as a young fella because you just don't know how to process all this stuff, and you would rather kind of be out the way than to be a burden. And I know people that felt like that, and so especially when people are recommending you go get some help, then you start to feel like, well, dang, is am I really a problem for y'all? And some people would just kind of be like, let me just go and slide out the way real quick. So
There's an IG page, and I might butcher the name, but you all might be following it already. There's an IG page that I believe is called Black Men Commit Suicide Too. That is the whole name of the page. So if y'all have some time, go find it. I'm hoping I'm close enough to what the name is and it pops
Yeah.
up.
we'll look
But
that up.
it's a nice resource to just have, because the fact that somebody recognized the need to even make this an IG page is very telling.
Yeah.
Right.
Hmm.
Okay. And I got one other question. While we're talking about this is when it comes to men, I hear a reoccurring thing. I don't trust therapy.
Mm,
Like, so
I've heard that. Yeah.
what can we say as advocates to help them understand it, or what would you say as professionals when somebody says, I just don't trust therapy?
I mean, my response is, but why not? I mean, you're trusting this food that you put in your stomach every day.
Listen,
Especially them pig feet.
You know what I mean? So why not just go out on a ledge and just take that chance to trust this? You know,
Right.
that's my take on it. You trusting everything else. You're getting on the highway. How you know this food next
Yeah.
to you ain't finna swerve into you, or you taking all these risks everywhere else. Why not here for something that could potentially help you?
Yeah. I don't see the detriment, but I think people were just put off by the terms that, oh, that means you're crazy. So folks, it's like, nah.
Mhm.
No, I think people
Nah.
just I think
Yeah.
people just do what they want to, because if a woman told a guy she on the pill, he gonna trust her that she on that pill.
That part. Yeah.
Very
Hey, that's the
true.
truth.
Very
So
true.
you
Yeah.
trust
At
what
least
you want
that
to
one.
trust. You trust what you want to trust, and you do what you want to do.
Uh-huh.
So
Mhm.
people can make up excuses for anything, but at the end of the day, it's got to get done. So if you know you need
Facts.
the help, you
Yeah.
gotta be you gotta be man enough or woman enough
Mhm.
to say, you know what, I need this help, and it's not just for you people.
It's for your family. Yeah.
It for the people around you. A lot of us have children, so those
Right.
Yeah.
children they depend on you. They
Right.
need you to be the best version
Mhm.
of you that you can possibly be, and sometimes that's going to require you to get some help,
Yeah.
right?
Facts.
So,
Mhm.
I'll ask you this, and we kind of getting ready to wrap up. What is one thing, Angel, that you wish every person understood about mental health?
Okay. I wish that everyone would understand that it's there whether you like it. It's just about where you at in that whole realm of mental health. Are you at your best? Are you at your worst? It's something that you're going to constantly have to work on. Constantly. If you want to physically look good, you're going to have to constantly work on that. If you want your health good, you're going to have to drink water. You're going to have to eat good. So it is something you have to work at. You have to teach your brain how to treat you.
Okay.
I like that.
Okay.
Yeah.
All right, Lauren.
along the lines that Angel was on, I wish people understood that your brain is a muscle, just like every other muscle in your body.
Mhm.
So you have to take care of it, and you also have to work it so that it works optimally for you. And just like every other muscle in the body, it can get injured. And therefore, you need to treat it appropriately so that it will heal. You can't just leave it alone and say, well, it'll get better. No, it's just going to get infected. If we keep the medical terminology, it's just going to get infected and you're going to feel worse. So I wish people were able to digest it in that way and understand that I have to care for my mental health the way that I care for my body. But there's more than just one thing I wish people knew. I wish people also knew therapy is not just about coming to this session and waiting for me to say something prophetic that just changes your life. So you can
like going to church, huh?
So
You're waiting for the lights to come down.
And now I'm like that happens in relationship. Like people think they can come to therapy and they're just going to hear something profound. But when people have those experiences where they have what we might call a breakthrough, that typically comes from them doing some work. And spending some time in a therapeutic relationship. And likely their therapist had to repeat something 17 times before they actually had the breakthrough.
Very true.
So like I wish people would understand. I love that you all are willing to take these first steps and even come to therapy to begin with. But you need to understand it is a commitment and it is a work. And there are oftentimes very specific techniques I'm using. I'm not just sitting in here listening to you and then boom, I have the breakthrough to give to you in these beautifully placed words. Like, no, sometimes the process of what I'm doing has steps to it, and you have to be willing to engage that. I think I'm seeing more and more clients who are coming to therapy. They're getting in therapy for the first time, and they're wanting to have aha moments in the first 2 or 3 sessions.
So they can get over and get done with it.
They want to hurry up and feel better. And I have to tell clients, I'm sorry, it's just not likely going to work like that.
Unless you have an encounter with Jesus. You Jesus, Lauren. I'm trying to tell you, girl.
A combination of Jesus.
You need God and therapy.
From Angel, like Angel write the right script, and I'm telling you, it's completely different. Like,
Lauren gonna get your mind right. Angel gonna get your meds right. God gonna get you together at the end of it all. Still
go give you a plan so that we can get you functioning properly, or have whichever the term is, but it's a plan and you got to execute a plan, just like a team, a football team. Everybody has to play their part, but at the end of the day, you can't miss your block. You got to block so I can get through the hole, so we can score this touchdown or get this first down. Everybody has to play their part, but at the end of the day, it's a play and you got to run it on a consistent basis. And I think that goes a long way when you execute what you know. We do it in a lot of other spaces in our lives. We get up faithfully and go to work.
Man, to give a sports reference, that's
right.
I'm sitting here and my eyes just went.
That was good, though.
I had to let him keep going. I said, okay.
I'm just saying, we're talking about the brothers.
He understands it. Okay.
Well, we ain't talking about the brothers right now. We talking about everybody. Like,
everybody.
This part's, I'm saying, affects everybody. And all of this stuff affects everybody, really, at the end of the day. But, I wanted to talk about the men for a second, because I know a lot of times, guys just kind of shrug this part of the conversation off. They don't want to hear it. They don't want to talk about it, or they have some negative experiences with it. But at the end of the day, guys, we like I keep saying, men, we have to do better. We can't lead if we're not, who we supposed to be mentally, emotionally, physically. Like it affects us on all levels, right? If you're folding like a 4th grade love letter, how you gonna lead the house? How you gonna lead? How you gonna make sure your kid's good? How you gonna be, the boss at work, or any other positions that require leadership? Everybody wants to be a leader, but they don't want to do what it takes in order to be prepared to be a leader. Everybody wants the position, but don't want to do the work. And I hear that a lot too when it comes to mental health. Is you have to do the work. It's nothing is going to come simple, and nothing is just going to be, your first session and I'm healed. It's not that's not the way it works. You're going to have to do some things, and you're going to have to go through some things to get to some things. So, it's a lot involved, people. It's not going to be an easy journey, but it's going to be well worth it. I promise you. So however long you have to go to therapy, whatever medications you may have to take, I promise you, you will be better for it. Trust me. All right. All right. So as we
Amen.
get ready to wrap up, Angel,
Mhm.
what message would you give someone silently struggling right now?
I would say, I'm a spiritual person. I do have to bring this into it. I do. Number one, you got to know that there is power in the tongue and power in your thoughts.
Yeah.
Okay. So you need to think optimistically and know that there's a solution to everything. I truly believe that there's a
Right.
solution to everything. It might not be like the perfect answer to what you want, but it could be the answer to get you to where you're going.
Right.
So I would say be optimistic, even though you are suffering in silence. Rely and try to talk to someone that you really, really trust. Open up that silence and really try to get the help that you need. That's what I would say.
Okay.
Love it. Love it. Love it.
All
Yeah.
right, Lauren, same question for you. What would you say to someone who is silently struggling right now?
I would tell them, first of all, don't believe everything you think
Mm.
because your pain will have you thinking the worst about everything and it will keep you from healing. I would also tell them you are not alone. I don't care what your thoughts are telling you. You are not alone. There's nothing new under the sun in the human experience except the names we give it. So
Right.
everything that you are quietly thinking and feeling, I promise you, someone else is feeling and thinking the same thing, or they have felt and thought the same thing. So you do not have to feel alone. You do not have to be silent. All you have to do is be ready. Be ready.
Okay.
Be ready. I like that.
Yes.
All right. Well, like I said again, we appreciate you all lending your professional opinions and help
Yeah.
and advice to people for free for a little while,
For a little
because we
while.
know
For a
you all
little while.
get paid to do this, and
Yes.
you all that are listening, whether this is on the podcast networks or YouTube or you listening live, please take advantage of the information that we provide you and the information that's out there when it, according to mental health. um it affects everybody, as we mentioned at the very beginning of the show. So whether you think you need it or not, just go get some help anyway, right? I like to equate it to when we go to we're supposed to go to the doctor at least once a year to get a physical, right? Your annual physical. And
You're right.
sometimes you might need a little dust up, you know what I'm saying? You might need a little mental health, you know what I'm saying, check in every now and again when you feeling that anxiety creep up, when you feeling that depression. A lot of people, that I know personally, have lost loved ones recently,
Right.
grief and things of that nature. It shows up in a lot of different ways. So
Right.
you got to stop self-diagnosing. There are individuals out there with degrees and a lot of schooling, and they get paid a lot of money, some of them, and they can
They got the
help
right
you.
papers.
They can help you, right? They have legitimate degrees that they've earned, and it's not honorary. And
Yeah. Yeah.
they
Yeah. Yeah. They did their dissertation. They
Well,
did.
they
Yeah.
can help.
They
They
got.
can help you. So,
Yeah.
in
Yeah.
all honesty, like I said again, we appreciate these ladies sharing their time with us because they don't have to do these type of things, but we are gracious
Yeah.
that they came to spend this time with us. And we don't have any other questions, but what I want to do is just make sure that you ladies have an opportunity to let the audience members know how they can reach out to you and find you on social media. So if they need your assistance, your help in your area, even if they're not in your area, I know both of you all can answer questions if you would like to, and kind of help get people steered into the right direction. So Angel, can you tell these people where they can find you at on social media, or how they can reach out to you?
yes, absolutely. So social media, I'm at Angel underscore Bonafide, Bonafide. You can also visit my website, premiermentalwellness.com, and I am licensed in Texas. So if we're going to do online visit, if you're in California, technically I can't treat you. Um, and you can find me on Facebook, Premier Mental Wellness, Facebook, and that's it. And then I want to do a shameless plug, please, for just a second.
It's
I
okay.
have these wonderful dishes for my sorority, Alpha Kappa Alpha, Sorority Incorporated.
Oh,
And they're beautiful dishes, and they're engraved, personalized with our founding members. So you can go to First Supper, PHIRST Supper.store and purchase your set. Thank you.
Yeah,
okay, Sarah. Yes. Okay.
yeah. I was gonna mention that, but I was gonna wait until the
Oh,
end and
were
kind
you?
of mention it.
Okay.
Yeah. No,
Yeah.
but you
You
all
straight,
good.
straight.
do whatever you feel like doing.
Right.
Thank you for allowing me to say that.
No
No, you
problem at
good.
all.
Good.
Thank you, Lauren.
So I am Free the Mind Therapy across all social media. So Facebook, Instagram, and LinkedIn. It's all Free the Mind Therapy. My website is www.freethemindtherapy.com. So you just have to remember that name. As long as you remember Free the Mind Therapy, you should be able to find me anywhere.
Right.
And I also just want to remind people too, if you don't know where to start your therapeutic journey, just start with your insurance. Call your insurance provider or go on your insurance provider's website and search, filter for a mental health provider. They should have those filters on the website so you can see which mental health providers are paneled with your insurance. I'm paneled with so many insurances, I don't even know all of them, to be honest. Like exhaustive list. So if you are in Georgia, because I am licensed in the state of Georgia, if you're in Georgia and you're just looking for a place to start, individual or group, check with your insurance provider and see if I'm paneled with them. And you might be talking to me anytime.
Yeah.
Mhm.
Yeah.
Cool,
I dig it.
cool.
I dig it.
I appreciate you all giving that information, and we definitely appreciate you all joining us today. And I just want to throw in right there too, y'all. That's what I did. I had to reach out to my insurance company, and I started out with a virtual visit. So they have the insurances that have that available as well, the virtual
Yeah.
visits.
Mhm.
So at least you starting somewhere. So just get started. As Lauren said, just get started. That's
For
the
sure.
key.
Right.
Yeah.
All right, Trish Michelle, talk to the people before we get up out and let them know something. Let them know where they can find you, because you know they're looking for you
No, they're
in the
looking for you.
daylight with a flashlight.
That's so country.
Right. I would say just don't be scared of therapy. A lot of people, if they're like, oh, you work with a bunch of crazies. Like, nah, I don't. Not really. There's a lot of normal people who need help. So, like,
Right.
I just want everybody to like know, even what Lauren said, like, you're not alone. Like, everybody, the world is a hot mess right now. Everybody's going through something on a different level. And then I love to always say, so just go just because you just don't even know what you
Right.
may unfold, because like they both stated, Angela and Lauren, you don't even see the signs sometimes that there is something that you're dealing with. And everybody, we will always say this, check on your people, because I literally, what's today? Tuesday? Or
Mhm.
Sunday, watched a man jump off the overpass
Yeah.
and we tried to stop him.
Yeah.
So yes.
Riverside. Yeah.
I was right there. I was right on the bridge. I was the car with the window down talking to him while the dude was trying to get out and talk to him, and we were calling the police. And he said that the rest of his family died. I don't know how or what, but he said that he had to when I was asking him not to, and he jumped. But luckily he's in the hospital right now. So with that being said, though, you just check on your people, because I don't know who may or may not have checked on him or what, but you never know what's
Right.
going on with anyone. And we have had a lot of people in the past 2 weeks in our area out here we've had some suicide jumps in this area.
Are you in
So,
Cali?
yeah.
Yeah.
Yeah. So yeah, just checking your people, guys. So I will say y'all can find me at Trisha Michelle _TM, but y'all know what I'm always gonna say. Y'all can find me everywhere, but if y'all not subscribed to the Fire Session, y'all not following the Fire Session page, and y'all not here on Tuesdays listening to us, don't find me nowhere else.
Facts.
That's all right, girl.
All right, Trisha Michelle, talk to
All
them.
right, forehead. Talk to the people.
And you know my forehead gonna shine y'all right onto the Fire Session and enter therapy, because I love to tell everybody my journey and what can help them.
Right, right.
Yes.
Yeah.
Facts. All right, Benji Banks, the man, the brand. Talk to the people, man.
Man, listen, you can find me everywhere. I got something for you in all walks of life. You need a good church, I got that. You need some food to fill your belly. I ain't got no pig feet for you though, but I got some good food for you. You need your wig done because sometimes you need to go feel better about yourself. You know what I'm saying? All of that stuff, man. We hands in everything, making a lot of
Benji a
stuff happen.
Renaissance man.
We gets it all done. You get what I'm saying? We take care of business and we make sure it's good. We make sure it's solid. And if I'm gonna put my name on it, it's gotta be dope. Because if it ain't dope, if it ain't live, it ain't me. So, and you can find us here at the Fire Session. But overall, man, like be comfortable with making the hard choices, making the hard decisions. After all, it's your life. You only get one of these joints, and you got to make the best of this thing. And maybe you should take the perspective of some of your mentors or some people that are around that will give you great advice. And sometimes, you'd like to walk around and feel good about yourself. And sometimes that comes from, making sure the people around you are good as well. And sometimes listening to them because they got your best interests at heart. So take it to heart. If your lady or your mom or your grandma or whatever saying, hey man, listen, think you need to go get, checked out, take that to heart and go do it. You get what I'm saying? It ain't no harm. Nothing go harm to you. I've sat in plenty of sessions, wife's licensed counselor, licensed therapist. And sometimes, man, you just need to sit down and listen to somebody with your best interests at heart, give you some great advice that you can apply to your life. And so make the hard decisions. Be comfortable with that, man. Get comfortable with that. So that's my spiel.
All right. Well, y'all can find me in some movies on Tubi coming to you very soon.
Yeah.
You know what I'm talking about?
Alrighty.
Y'all can hate on Tubi if y'all want to. It's
I
okay.
hate no
It's
Tubi.
I
okay.
love me a good
I
Tubi
love
movie.
It's
Shoot.
okay. Yeah. I appreciate that because people are coming around. Some great projects, some great projects on Tubi. Some great film on
It
Tubi.
is.
So your boy in the movies, and I'm writing them. So we're
In
trying to
that
get
thing.
active. We're trying to broaden our perspectives out here.
Yeah.
So
Okay.
Yeah.
I appreciate the support when it come through, and I appreciate the support that's already come through with the plays that I've been a part of and things of that nature. And people really been supporting you, boys. So I
Fact.
appreciate that. That I'm in my acting era. You know what I'm
Yes,
saying? So
sir. Yes, sir.
instead, I've gone from acting a fool to acting really in movies and shows. So
Get paid.
you know what I'm
Yeah.
saying? Yeah.
Get your Tubi on. Get
Yeah.
your Tubi.
Hey,
Get your
fact.
Tubi on.
Hey, you know
I dig
what?
it.
You got to start somewhere. As
Hey.
Lauren said earlier, you just got to get started. And that goes
Yeah.
for
Mm-hmm.
everything in life. Just get
Mm-hmm.
started. All
Yeah.
right. All right, y'all. We gonna get up out of here. I just want to leave y'all with this. Taking care of your mental health is strength, not weakness. You gotta remember that.
Facts.
Conversations like this saves lives. If this episode helped you, please share it with someone who may need it. And please and thank you. You take it to heed as well. Like as I stated earlier, y'all, your boy was struggling, and I didn't even know I was struggling until I got deep into it. And
Right.
I had to get the help. If I can do it, you can do it. So
Facts.
just get started, as Lauren said. There's many places, there's many options out there. Just get started somewhere. Salute. All right. So you already know you've been rocking with Trisha Michelle, Benji Banks, and Big Ken. We are the Fire Session. Thanks again to our special guests, Angel Adams and Lauren Pierre, for their
Yeah.
amazing and informative conversation tonight. Make sure y'all like, share, and subscribe on all platforms so you don't miss the next session. And remember, if it didn't challenge you, it didn't change you. Until next time, keep your energy high, your circle solid. And as Trisha Michelle said earlier, check on your people. All right, y'all, stay lit. It's the Fire Session. Peace.
Deuces. Bye. Bye.